This segment is sponsored by Delta Dental Insurance. September is Healthy Aging Month, and did you know that 35% of women over 40 say their oral health has declined as they've aged?
So I got the chance to talk with Sarah Chavaria, the CEO and president of Delta Dental Insurance, about how you can talk with your dentist about the impact of menopause on your teeth and your gums. Take a look. Sarah, excited to have you here to talk about menopause. What can we as women expect our oral health to change during menopause?
Yeah, sure. So during menopause, perimenopause, our estrogen levels drop, and those hormonal changes can reduce saliva production in your mouth. And so some of the things that you might experience are dry mouth, burning tongue. When you brush, your gums might bleed. They might be receding, maybe even tooth decay. And, we surveyed women 40 and older in this survey, and over half of them said, wow, we had no idea that this was related, even though a third of them are experiencing these things.
I'm heading into that perimenopause stage. I had no idea about any of this, but your findings showed that dentists are willing to talk to women about this, right? What kind of questions should we be asking? How can we get that conversation going?
Sure. So yes, 84% of dentists said, hey, we're willing to have that conversation. But importantly, more than half of them said, but we don't want to initiate that. So as women, if we're not comfortable walking in and saying, hey, I'm perimenopausal or menopausal, maybe talk about the symptoms. I know the setting isn't that private, so maybe say, here's what I'm noticing. And if you feel uncomfortable still, maybe send an email the week before or so and say, here's some of the things that I would love to talk about.
To your point, women might be a little hesitant. So why should we be having these conversations? Why is it so important?
Well, I'll give a really specific example, just one, but oral health is part of overall health. And when that dentist is doing that oral health check, the oral health of your mouth could point to your heart health. So it could impact it, it could point to that. And more than half of our women said, oh my gosh, I had no idea. And when you get into menopause, you start thinking about your heart health a lot. And we know that 2/3 of women are not having that conversation at all. So that's just one example of why it's really, really important that we focus on this and talk about it.
What would you like to see in women? Like, what should we do to improve our oral health now knowing that it can be affected during this time?
Some really simple things that we can do at home are, with that reduced saliva production, like drink water, keep your mouth really, really hydrated. That's really important, good for your overall health. I know you don't want to, but floss once a day, and make sure we're making those appointments twice a year. It's an oral health check. It might be the only time you're talking to a healthcare provider, and it's really important as a part of your overall health.
What are you hoping to see changes-wise as women learn more about this?
We're already seeing some changes. We're really encouraged just by the survey. 82% of the women who took it said, oh my gosh, I'm going to go make that appointment. And most of the women said, I'm going to take better care of my oral health. Look, we're supposed to go to the doctor once a year, dentist twice. We know that 27 million Americans forego that doctor's visit, which means the only time you might talk to a healthcare provider is at the dentist. So really, really important. We know that 93% of women want that tailored, personalized advice, because none of us are going through this the same.
All right, I'm going to be armed with some questions for my next appointment. This was so enlightening, Sarah. Thank you so much. Where can we find more information?
Please go to ddins.co/menopause. My team's done a great job of curating a bunch of information out there, including that email you can send.
Perfect. Thank you so very much.
Thank you so much for having this conversation.
Such fascinating information, no matter where you are. Again, for more information on how menopause impacts your oral health, you can go to ddins.co/menopause.